it could be so helpful, right? When we help those patients know that these things are actually interrelated
Right.
and they're not crazy. It's not just all over the place. It is challenging. So we've really got to help them navigate a
Mhm.
lot more pieces that could be contributing to their
Yep.
symptoms. But I think a lot of people still, can benefit from that information, just knowing that those
Right.
things are connected and that their symptoms do make a lot of sense.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the show. Our next guest is going to talk to us about a topic that it comes up more often these days, I think. Hypermobility is one of those things that I feel like it's popping up in more conversations because we're finding out that in the data that there's more kind of systemic issues related to it. I got kind of drawn in on the topic many, many years ago, having worked for a dance practice. I am not a dancer, but our next guest is very much an expert in all things dance, aerial performance, all this good stuff, and is going to chat with us about hypermobility. So, Brooke Winder, welcome to the Active Mom Podcast.
Thank you. Thank you for having me.
All right, so tell us a little bit. You're a PT, you're a mom. How does one get involved in working with dancers, performing artists, aerialists? Like, where that was not the plan in PT school, right?
Some of it was, but like most of us, then some things sort of you fall into. So I have danced since I was young. I started dancing when I was 3 years old. And I was also a competitive gymnast. And my early life, I was actually much more focused on gymnastics, which is sort of how later I came to relate to working with aerialists and circus performers. Um, and I did gymnastics competitively till I was about 14, got super burnt out. I was dancing along the side, but my love for dance really grew. So I stuck with that throughout high school and I ended up studying dance in college. So I have my BFA in dance. And through my dance experience, probably like a lot of athletes, I had my share of injuries. I was pretty lucky. I have kind of more overuse type of things, nothing really huge that sidelined me, but when I went and saw PTs, I thought they were awesome. And I also learned very early how hard it was for dancers to explain to anyone in the medical community who didn't dance what on earth dance is about. Um, and the more I started talking with friends of mine in dance, we all had a very similar experience at the time, which was having to explain how difficult it is on the body, having to kind of try to advocate to feel like we were treated like athletes. So that sort of sparked my interest in seeing that I thought there was a big need for more people in PT in healthcare who understood dancers really from that experience. So I was interested in that, and I took all my prerequisites for PT when I was in undergrad while I was getting my dance degree. Um, and then in PT school, I was like, I'm gonna just really go heavy on ortho. I was a big ortho nerd, and still really wanted to work with dancers. I know we'll get into this. I hadn't really thought that I might end up with doing a lot of pelvic floor work at the time.
None of us did.
You know, we didn't have a lot of it in our curriculum at the time. I had one classmate out of almost 100 who had done a rotation in pelvic floor work, and it's kind of like, oh, that's super cool. What are you up to? But it really was on that dance train, so to speak. And I did get to do some research in PT school because someone in the biomechanics lab who was not a dancer herself, she just got really interested in dance, was looking around for any dancers who might want to work in the lab. They were doing some tendon studies,
Mhm.
tendinopathy studies on dancers at the time. So I got my little bit of experience in research, which I really hadn't done any of when I was in my dance degree. Um, And kind of between undergrad and PT school, I performed for a company that's based in Orange County called Backhouse Dance. So had my experience performing. I did a little bit of teaching in dance. So that helped me really stay connected to the dance community in Southern California. So then when I finished PT school and I started treating, I stayed connected, giving workshops on injury prevention, doing little things here and there with local studios. I worked at one point with, a dance team at a local high school, but I treated a little bit of everything when I first started. And it so happened that a lot of maybe low backs and hips that needed care came to me. So people that had concerns with low back, SI joint pain, hip pain, continued to come my way, and I really fell in love with working with that. And I worked alongside someone who was trained in pelvic floor PT, and that was sort of what opened my eyes to realizing there was this whole other area of the body
Yeah, I feel like if you're
sitting
doing
between all of
backs,
that.
yeah, if you're doing back and hip, it's a slippery slope to the pelvic
Yeah,
floor. And
you're going to
then
end up there.
right, and then I feel like if you're working with dancers, it's gonna be and pelvic floor, it's just gonna be a slippery slope into hypermobility and kind of navigating that whole dark horse and whatnot.
Yes.
So yeah, so for those that may not understand the dance world, why do we find so much hypermobility? Whether it's like, one end of the spectrum with like Ehlers-Danlos, maybe kind of dive into that a little bit versus like they feel like they're tight, but it's not tight to me. Like, talk
Yes.
us through why like that's a necessary evil, however you want to call it, in dance.
Sure. So a lot of forms of dance, and it is challenging for people maybe who haven't seen a lot of dances. There's so many different types and forms of dance. But in general, most types of dance involve visiting extreme ranges of motion as a natural demand, particularly in the spine. So lots of arching the back, lots of extreme spinal extension or flexing the spine for twisting. There's lots of extreme hip positions that dancers have to move into in various forms of dance. And same with the foot, especially pointing the foot downward depending on the form. So, because of the demands, it seems like a lot of the people who end up in that activity kind of already have this predisposition to be able to get into those positions where it's not as uncomfortable as someone who might be naturally stiffer. So it tends to draw a lot of people who might already have more range of motion anyway, might be hypermobile. And then the way that we train is kind of prioritizing a lot of that hypermobility in order to kind of reach the aesthetic of whatever choreography that we're
Yeah.
doing. So that's it's sort of a natural draw for hypermobile bodies.
Yeah, absolutely. As a self-professed stiff person, it was never on my dance card, quite literally. But no, but working in a practice that, had focused on dancers, I really learned a lot about how much physiological range of motion can exist. But I think the
Hmm.
last point that you made, that you learn to train throughout that range of motion. And I
Yeah.
think that's such an important point as we shift ahead to somebody who has maybe a history of working or a history of dance and then maybe doesn't do it anymore. And then what I see are all the like teenage dancers that then take up running in their 20s and 30s and things like that, but they're not working through that physiological range of motion anymore.
Hmm.
I'm sure you kind of have an idea what I'm talking about here. Like, talk us a little bit through where that shift occurs, where you might have somebody like you see that they professionally continue on in dance or, some sport requiring that range of motion and training through it versus somebody who maybe isn't training through that range of motion because they're not participating in it any longer.
Yeah, yeah. I think kind of in those two ways. So our dancers who might be continuing on through professional careers, or we'll talk about that first. They're continuing on, they're going to be training consistently in those ranges, which is like anything, sort of a double edged sword, where they're getting a lot more repetitive load in extreme ranges of motion, which may or may not be great for them long term, depending on how they're supporting their body through that. But on the other hand, on the positive side, they're practicing that, they're staying really agile and coordinated and hopefully strong so that they are using the range of motion wisely, and maybe, through their professional training also hopefully have support. We can talk a little bit about why a lot of dancers don't have good support in that end. So it can be positive and negative to kind of continue through that. And then we might also have, like you said, someone who starts out using all of that range of motion and then transitions to a new sport or a new activity, or they're just not doing as much dance as regularly. They are working their job that doesn't have to do with dance. They might be sitting more, and they might not have all day to train, right? They've got a life, they have kids, they've got lots going on. Then when they try to either move into those ranges, it just doesn't feel the way it used to, or their body is starting to stiffen, which can be really frustrating, I think, for a lot of people who grew up dancing, because dancers are really smart movers. So we can sort of get this impression that we can try anything and be pretty good at it. Even if we're not quite strong enough to do it, we'll find a way, which can get us into trouble. And I think the other piece where people might be maybe not using that range of motion anymore is that dance is a little different, I think, than other sports. It is catching up. We're getting there, but we're a little bit behind on the sports science implementation compared to other athletes, where a lot of people grew up not understanding that cross training should be a thing for dance, that to get better at dance, you just do more dance. So a lot of dancers might not, if that's all they did when they were younger, they just might not have been exposed to lifting weights. They might not have been exposed to strength training in particular. And then they try a new activity. Maybe they start running and their muscles don't have the endurance to support them or the strength to support them well. And that's where maybe they find this mismatch where they could run into some trouble, start to have pain, start to have problems.
Yeah. One of the theories, and I would love your thoughts on this, not only being a dancer, but a mom and kind of working with people that have a lot of mobility, is that we learn a lot of our movement strategies when we're kids. And so if you said you were dancing from the time that you were 3, one of the questions I always ask my patients is what sports that they did growing up, because that to me tells me genetically kind of what your predispositions are. And this is great for telehealth because I may not be able to get a sense of your flexibility and whatnot. But if you tell me that you were a dancer and a gymnast, and then you went to school for dance, your body was working with that as opposed to mine, which would not have. And so I'm already thinking that you have learned, one, genetically, you've got a lot of flexibility, but 2, these are 2 very aesthetic sports. And as a young girl being taught to, and we're going to kind of segue into pelvic floor here, taught to hold yourself in a certain way because you were being graded on your aesthetics, or you were taught to hold a certain position. Obviously, understanding dance and different types of dancers, there's different aesthetics and so on. Can you explain that, kind of maybe from your experience yourself and then reflecting back upon it, but also what you see as a pelvic floor PT kind of working with this population that's a little bit different than just the average person that may not have done a sport with an aesthetic component or a hypermobility component or something like that?
Yeah. Maybe coming from my own experience. So my memory of training in gymnastics and in dance, and maybe to share for people that aren't familiar, you're wearing minimal clothing typically, or very tight clothing. In dance, you're in front of a mirror a lot. And that can certainly, especially through those teen years, as your body's changing, just bring on a lot of stressors about body image, about, dance has a lot of work to do still in terms of widening the acceptance of more body types. I think we're starting to get there, but at the time for me growing up, it was really this sort of like thinness oriented way of training. And I trained in a lot of ballet and contemporary dance where it kind of sits in that a lot. so there was that end where you sort of felt then, okay, well, I feel like I've got to like hold in my muscles all the time because I'm in this tight clothing and I'm trying to make myself smaller. Um, and on top of that, there's a lot of patterns in the way that people cue how to use your core in particular.
Mm-hmm.
And I still see this a lot with dancers, even from lots of different forms of dance, that this impression that if you're gonna use your core well, then you need to be just standing there, not even doing anything demanding yet. You're just standing and holding your posture, and you should be like pulling up and in your belly. You should be pulling your belly button to your spine. You should be lifting up and in kind of through your pelvis. They don't usually go like specifically about the pelvis, but they'll kind of cue that. So there's this developed that is just this chronic pattern of the way that they hold their core is very tight and maybe just kind of limited to that one strategy, which can certainly cause a challenge later on when they're learning to move a different way. So I actually spend a lot of time teaching dancers that they can learn how to pull in sometimes, but they probably don't even need to pull in that much. Like if you're just standing there, you don't need to be working that hard in your muscles.
Yeah.
And that they can learn to do lots of other types of strategies that maybe don't add so much pressure kind of within the core, because that can potentially start to mess with their coordination in terms of their core and their pelvic floor.
Yeah, no, the thing that always comes to mind when I've had somebody with more than a couple years of dance experience as a kid is we're looking at potentially a high tone pelvic floor.
Mm-hmm.
And again, the, if you're not familiar with what that is, just a pelvic floor that's on probably more than it needs to be in a resting tone.
Mm-hmm.
And we're seeing, and I don't know if this was something that you see a bit, but like young gymnasts with stress urinary incontinence, that's something that we see quite often with a high tone pelvic floor. But again, like, why does the brain adopt that strategy, especially seeing, people as adults? And my theory is, again, somewhat aesthetic, is this is how you were taught as a small kid, that this is what you need to do. And we kind of hold on to those patterns. But also, again, like, if you're super mobile later on and you're not moving through these ranges of motion, is that how your brain's trying to find stability? So
Right.
that's kind of a thought process that I've sort of clung to for a while. Tell me kind of what your thoughts are about that.
Yeah, I agree. I agree. I feel like it comes from, this interesting place where I think there's that aesthetic component, like you said, the taught strategies of holding in. And then if you already have hypermobile joints, let's say you have a hip that has within the socket just more ability to move, or maybe not quite instability, but it's really got a lot of wiggle room, so to
Mm-hmm.
speak, and you are putting it through those demands repetitively, it would make sense. And maybe your pelvis has the ligaments around your pelvis have more mobility. It would make sense that the pelvic floor has this compensation or reaction or response that contributes to more high tension or tone.
Yeah.
I see it all the time clinically. I know it's one of those things that's sort of hard to prove in the research, but I see it a lot with my patients, and kind of a lot with just dancers and in the way they're training and other athletes that train similarly. And even from my own experience, and one of the other reasons I combined this interest now in pelvic floor and orthopedic work as well as with performing artists is when I was a gymnast, I I have some bendiness to me, which, like you said, not surprising because of the sports that I chose to do. Um, and I was one of those kids that, like, if I would stretch for a long period of time, sometimes I would get out of that position and feel worse, which is really common
Mm.
with people who are hypermobile. Um, I I also started to, especially as I got into higher levels of gymnastics, I never had leaking during my training, but if I laughed really hard, I would leak.
Mm.
If I coughed really hard, sometimes I would leak, and it would be really, really embarrassing for me because I was heading into my teen years. I
Mm.
told nobody. about it because I didn't know who I would tell, who I would talk to about it. I thought this is so abnormal. Um, and it all sort of made more sense to me once I started
Right.
to go into PT. But I likely had some of those combined factors. And I
Hmm.
think another piece to think about is like a lot of sports, if you're in those sports that are highly competitive, like most sports can be, and you're really maybe more of a type A human, high achieving human, and you're carrying a lot of stress, um, that may just not necessarily help with that already high tone that could be present at the pelvis.
I'm smiling because those that listen to the show know I'm in the DC metro area, and we like to take type A to another level.
Yeah, I can
So
imagine.
when I have someone come in and they're like from North Jersey, or they're anyway in East Coast or West Coasters, like you guys are a little bit more mellow. Although the ones that transplant here and are really happy, I'm like, no, you really belonged here. Plus they had a dance history, plus they're hypermobile, plus. I'm like, yeah, no, I don't even need to look at your pelvic floor. Like,
Yep,
it's high
it's
tone. I'm
so
just going to
true.
tell you that right now.
Yep.
And to give a little nod to research, like I think part of the issue too is we come up with these things clinically because again, I think you and I have been out a similar amount of time. Like we only used to acknowledge high tone pelvic floor in like chronic pelvic pain or painful penetration or things like
Right.
that. We're seeing it much more now playing out in stress urinary incontinence in adults and kids
Hmm.
and potentially prolapse symptoms. I think
Right.
the research has been so focused in the pelvic floor on strength, and this is something other than strength. And I think
Yes.
we're still working on finding the right mechanism to test and measure what this
Yeah.
actually is. And it's really hard to measure something in an intimate place in someone who is doing a move like dance. And so
Yes.
that's where I think we have to give a lot of credence to our clinicians that are on the ground and saying, okay, something is up. We're not really sure what it is. We're going to quote call it high tone. It could be that, maybe it's something else, but we do have some tools to kind of figure out this part and parcel. Because again, like when we look at that, can't change your genetics. Maybe we can change your
Hmm.
stress a little bit, maybe not. Maybe we can change how you move. How can we teach your brain that there's another option other than this like huge,
Yes.
like grippy thing that it was taught when you were 3?
Yeah. And it's really interesting too, kind of relating that to hips. So
Mm,
I work at in a university dance program, mainly as faculty, but I do wellness visits with the students and I treat my patients on the side. But even within a wellness visit, I might have a student come in who's trying to do a movement and they're like, I just feel so stuck in my hips, so grippy in my hips. And I watch them move and they are doing this real clenchy pattern. Um, and I'm like, what would it be like? I might do some strategy. What would it be like if you just kind of let your sits bones spread or you just like didn't try so hard? Just explore, just try it. It's very anti maybe how you've been trained because I think in dance we also have this thing that like if it's not hard you're like not in you're not creating art because it's not suffering um, and
that's a good
and
one.
and
I
that's kind
like
of
that.
another piece we can think about with dance is there's this artist and creator component
Yeah.
that kind of interweaves but can you just bend, can you just do that plie, that dance movement and just try to let it go a little bit and you don't have to actually make your muscle, just let your bones move. And they're like, oh wow, my hips move so much easier. And they were probably just learning a new strategy, right? With their brain to their body.
Right.
And that alone could be a really cool thing that they can then take back into the studio and just go, okay, so now use that as an experiment. What is that like for you to breathe a little more? You can
Mm,
breathe a little bit into your stomach. It's okay. You know, let your pelvis kind of feel a little bit more free and see if that helps, right, with that hip
hmm.
gripping. And sometimes, that's a really nice way for them to kind of find that inroad
Yeah.
with that grippy pattern.
You're not only finding like a physiological change, but I'm sure you're like challenging years of strongly held beliefs, which I'm sure takes a
Yes.
little bit of work.
Oh, yes. a lot. And
That's when we
I
put on our
kind of tell
psychologist
them
hats.
exactly. And it's one of those things where I'm like, you're going to go, like a lot of dancers do a lot of other training. Um, so I'm Pilates certified. The way I was kind of taught about the core in Pilates, I think that's shifting now, but
Mhm.
kind of we were taught to really cue a lot of drawing in of the abdominal wall at the time that I trained. Granted, I trained 20 years ago. Um, so that has shifted, but I think those stories still kind of stay.
Mhm.
And so I'll have to kind of tell the performers I work with, you might get that cue in a class.
Mhm.
And that might be a fine cue for someone else, but you've got to sort of let it roll. It's not the cue that you need, that's all right. But you're just,
Mhm.
what's going to be hard is you're going to keep hearing it
Yep.
again and again that you have to pull in, but it's not you specifically, and maybe not a lot of
Right.
people in the class.
Yeah.
And it's so interesting, right? We all carry our stories so much. I think dancers kind of carry their stories about their posture
Yeah.
really closely to them because their alignment and aesthetic is so important in terms of what they're trying to
Right.
convey to the audience. And dancers are also super body aware,
Yeah.
sometimes too aware,
Yes.
where and really want to know if they're doing it right, so they can get into a habit of really analyzing
Yes.
whether they're doing it perfectly so much of the time that it can be a really interesting practice for them to help them prove to themselves that they could try it a different way and that they'll still
Right.
be okay and that it
Yes.
actually could enhance their performance.
Yeah, no, I find that a lot. And again, I think it's so interesting to know how much training somebody's had and that that's part of kind of, again, how they learned to work in their body. That those are those
Mm-hmm.
patients that want like all the cues and am I doing this right? And what is this? And I'm like,
Yes.
I am not a minutia driven therapist. I haven't found the value in it. And so I have to really be cognizant of I'm not being blasé about this. I'm not like discounting your need to know these details. I am challenging you. I
Mm-hmm.
know you know how to do it that way. I am challenging you. Can you do it a different way where and it's like a brain and a body exercise because that's what they were taught that they needed.
Mm-hmm.
But yeah, it's a unique challenge for us as therapists, not in not having been brought up in movement that way myself, to be like, okay, they need an extra little second to work with this. It's a different
Yeah.
learning concept. It's a different learning concept. But it's a fun little challenge though. I'm
Yeah.
curious when you mentioned circus performers and aerialists. First of all, tell us a little bit about kind of what that body looks like and what those demands are in those particular kind of professions. Because I'm sure everybody's gone to see Cirque du Soleil or something like that, but don't realize how much is involved in that. And then what are some of the common, issues that people will have, maybe more relating towards pelvic floor?
Sure. So I am not I'm a dancer, so I kind of fell into the circus world because I'm involved in the Performing Arts Medicine Association. I'm involved in the International Association for Dance Medicine and Science. So it's a pretty small knit healthcare community in that way. And I've got to know a lot of PTs that are more expert that came from that circus world and sort of got drawn into it, and took some initial classes, understanding like one of the things that's so unique, right, for an aerialist is that they're hanging. They're
Hmm.
suspended from, they're not a ground athlete, so they're suspended. And that was kind of my first foray, learning about the shoulder and kind of how those artists train. So that's something that's really unique, is they may be hanging from like a trapeze bar, they may be hanging from silks or different type of materials. So their stable point is changing often between shoulder hanging and then maybe they're also in a harness or they've got the wrap around their pelvis. So the pelvis is a stable point rather than
Hmm.
maybe connecting to the ground a different way. Um, and similar to dance, but maybe on a higher end, a lot of extreme range of motion is
Mm.
explored, more so, particularly in the spine, and even to a more extreme range in the hip. Um, so it relates to what a lot of dancers, maybe gymnasts too. I would say it's a little closer on the gymnast side.
Hmm.
Um, and they're often flying through the air. Um, and then we have, there's so many different types of apparatus in circus. I've worked mostly with aerialists, kind of fallen into that. But you may get someone who does circus arts and they do trampoline work and they are a ground athlete or maybe they're a contortionist. So one of the things that is probably helpful for people to know is just that circus artists, if you're treating one, to say, okay, what types of apparatuses do you train on? What's
Hmm.
your thing? And then they can give you a little bit more specifics
Hmm.
um, to learn because there's such a wide
Right.
variety. But they are encountering a lot of forces. Someone who's an aerialist who might be working in fabric, they do basically like a drop
Yeah.
sometimes, or they drop and catch in the fabric. And so their pelvis is taking the impact, but it's still in the air and it's through this fabric. So that's something that's interesting and unique with them as well. A huge amount of hypermobile humans participate
Hmm.
in circus arts because a lot of the demand is quite extreme range of motion too.
Hmm. Now, when we talk about hypermobility, just can you give us a brief explanation if people don't know kind of what we're talking about? Maybe just basic bite and scale or other things that people might use to categorize hypermobility.
Sure. Yeah. So hypermobility is really just having more than an average range of motion in your joints. And then hypermobility can sort of present along a spectrum of involvement. So the bite and scale is a basic example is really maybe revealing. So if you can hyperextend your elbow more than 10 degrees, if you can hyperextend your knees more than 10 degrees, if you can bend forward easily and touch the floor, keeping your knees straight, if you can bend your thumb towards your forearm like this and touch it, if you can bring your pinky into extension or back beyond that 90-degree angle. So that's one scale to just, it's a screening tool for hypermobility um, to look to see if your joints have more than the average range of motion. There's lots of other scales that are used out there that can be maybe more helpful. Um, but hypermobility, a lot of people talk about it as sort of this tip of the iceberg, where
Mm.
some people might have a lot of bendiness in their joints. And maybe it's even in one joint, like they've just got a really mobile shoulder or a really mobile hip or a really mobile knee. And it doesn't really cause pain, doesn't really cause problems. It might be isolated, or maybe just their fingers, just their kind of peripheral joints have hypermobility, doesn't cause problems. Um, and then we could have this experience where you have bendy joints, you maybe have more than one, and you get pain. So it's
Mhm.
not just that you move through lots of range of motion, but you might be experiencing a lot of discomfort with that. And then that could be more severe where you have even instability. So it's someone who's like, I've dislocated my shoulder a couple of times, or my kneecap has dislocated. So someone who's had kind of that instability or subluxation or
Mhm.
dislocation. Um, and then below the iceberg is sort of like hypermobility can be a signaler that there could be actually a lot more going on.
Mm.
So if you've got bendy joints and you start to have all these other symptoms that often seem not related at all, that's where we might look into, it's called hypermobility spectrum disorder, even Ehlers-Danlos syndrome. So there's perhaps a genetic component. And so with some of these things, your connective tissues are affected throughout the body. And there's so much connective tissue in the body that it will surprise people that these things are connected. So
Mhm.
someone who might have bendy joints and have pain, and they don't react the same way as someone else to like getting a local anesthetic. Like you go to the dentist
Mhm.
and you don't get numb as easily, or
Mm.
um, you might have trouble sleeping, or you might have uh, GI issues, lots of digestive issues, bloating, discomfort, pain. You might have really painful periods. People with maybe more of a genetic hypermobility often have really stretchy skin,
Mhm.
or their skin maybe bruises more easily. If you get a cut, it doesn't maybe heal quite as fast, or you scar kind of abnormally very
Hmm.
easily. And all of those things seem sort of all over the place, right? But it's actually can be very interconnected
Hmm.
uh, if someone's got kind of more of a genetic or systemic hypermobility.
Yeah, some of the other things I feel like have come up a lot more recently, awareness wise. Um, do you deal much with POTS at all, or people that have, maybe you can kind of dive into
Yeah,
what that is and explain that a little bit more.
yeah. So a lot of people will call it sort of this triad where you can have a hypermobility syndrome and it overlaps a lot with POTS and then something else, MCAS, which we could talk about. But POTS is postural orthostatic tachycardia syndrome. And basically, what that means, if someone might have POTS, their autonomic nervous system is not really regulating their essentially like blood circulation responses correctly. So what patients with POTS often experience is a lot of maybe dizziness, especially with changes of position. They can get heart palpitations at weird times. They can have episodes of fainting. And that can really interrupt a lot of daily life, and especially things like participating in sports. So like for my performers,
Yeah.
sometimes they'll say, yeah, I'm getting this dizziness, but it's so vague and it's not something that's visible to other people. So
Hmm.
it's like really hard to tell the choreographer that I experienced this. And sometimes that puts me out for the day.
Right.
Yeah, so that can be a really frustrating and sometimes super debilitating set of symptoms that
Hmm.
people who are hypermobile can experience.
What was the other one you mentioned? MC.
Oh, yeah, MCAS, so mast cell activation syndrome, is kind of another piece in this triad. We're especially kind of starting to get a lot more research that's putting these things together. Um, so, with mast cell activation syndrome, essentially, the mast cells are part of our um, kind of immune system responses. And so they release things like, let's say you were in touch with an allergen or something, they release histamine, they release things that would make your nose stuffy or you break out in a rash. So someone with a mast cell issue, the mast cells essentially kind of what they call degranulate. So they'll release these histamines and they'll kind of have this over response or they'll respond a lot. So someone with this issue might react to so many different things, like to put tape on, their skin will react to the tape really easily. They have a hard time with medications because they might get a lot of allergies to that.
Hmm.
A lot of foods will be something that triggers their symptoms. So a lot of, yeah, skin rashes, GI symptoms, that can also cause overlapping things like feeling dizzy. So it can be really confusing for
Yeah.
patients who experience all of these things.
Yeah, I feel like those of us that have been in pelvic floor world for a long time, we've kind of known about that with a lot of pelvic pain diagnoses and things like that. I
Hmm.
feel like everybody's sort of catching up to us a little bit because a lot of people are getting diagnosed with POTS because there's that correlation too with long COVID. And we're just seeing
Yeah.
a lot more of this around.
Yes.
And again, like I feel like we're in such a good place as pelvic floor physical therapists, already familiar with some of these things. And again, with POTS, one of the things that I always have run into are urinary issues too, like urgency,
Hmm.
frequency. Um,
Yes.
and I was always kind of thinking, okay, well, if they've got hypermobility, is it a stability issue? Are they trying, is your brain prioritizing keeping you vertical? Like, but
Hmm.
there may be the mast cell stuff too. Like, I feel like there's so many
Yeah.
parts and pieces of this, but I'll get patients referred to me for in their 20s, urgency frequency, they think it's a pelvic floor issue. And I'm like, actually, no, I think you have POTS. And
Yeah. Yeah. And I think that's what's really challenging. I mean, we have some research that shows that people with hypermobility, and especially if they have a systemic hypermobility issue,
right.
have a higher rate of experiencing lots of pelvic floor type symptoms, like you were
Hmm.
just saying, urgency and frequency, more pelvic pain, more vulvar pain.
Hmm.
Um, they're having higher rates of prolapse symptoms, more
Right.
severe symptoms, and it is challenging, like you said, because it it could be that they're like learning to relax the tone of their pelvic floor. They've got their core doing the right coordination. They've got their
Hmm.
body strong, and they're still maybe having those symptoms are not changing, that could be driven from the POTS and
Right.
both, and the MCAS can cause those symptoms too. So it could be so helpful, right? When we help those patients know that these things are actually interrelated
Right.
and they're not crazy. It's not just all over the place. It is challenging. So we've really got to help them navigate a
Hmm.
lot more pieces that could be contributing to their
Yep.
symptoms. But I think a lot of people still, can benefit from that information, just knowing that those
Right.
things are connected and that their symptoms do make a lot of sense.
Yeah, no, I think that's such an incredible point because especially when you get a whole bunch of diagnoses, we tend to be the people, I'm going to say we as pelvic floor therapists, because I think we just get whatever people are not sure what's about, they'll throw it at us and be like, all right, you figure it out.
Yeah.
When you get all these different diagnoses, I think we're in such a key place to be able to pull this stuff together and say, no, this isn't multiple things. This is how these things are connected,
Yeah.
when they don't sound like they normally should be.
Hmm.
And again, I think understanding that somebody has a background of a dance history and maybe has some hypermobility, again, I'm already kind of thinking in that direction. I'm already thinking, okay, a little bit of high tone. And if they come in with a diagnosis of prolapse, I'm going to ask them, do you have genetic history? Did your mom have one? Um,
Hmm.
and then I'm not sure if you run into this too, but like I'll have somebody that comes in with prolapse symptoms. They feel that tampon dangling feeling or that awareness, and we can examine them every which way and it doesn't look like there's really any anatomical prolapse, but they very much feel it.
Yeah.
I think there's something with hypersensitivity or awareness, or something that we still
Yes.
haven't quite put our finger on what it is, but they do respond really well to that down training and that kind of desensitization
Yeah.
approach.
Yeah, 100%. It's a very similar experience over here. Um, and another thing that's interesting is with especially more systemic hypermobility, um, we've seen a lot of relationships also with neurodivergence, and so maybe
Mm,
having um, hypersensitivity in terms of the sensory system,
yep.
and and maybe that's also a piece. Or is it the kind of chronic pain and symptoms that they've had
Right.
related to all of the things put together that just
Hmm.
really sensitizes their system to those
Yeah.
sensations? And as I said before, I think a lot of athletes and dancers in particular are so body aware
Right.
that that's also another factor, just
Yeah.
that in one way is really helpful because they know themselves really well, but is
Yeah.
something to really help them work through in terms of what their
Yeah.
body is paying attention to and alerting them to.
Yeah. No, I think it's unique too when you have somebody that is used to being a mover and then they're confronted with all these things that they're being told not to move, when actually helping them find movement again in a way that is cognizant and respectful of kind of understanding all of these things can be very beneficial for them. It's like, okay, I need you to move
Hmm.
again for all of these different reasons, but we need to do it in a little bit different way. And this is going to be
Yeah,
hard and it's not going to feel the same, but it's eventually going to start to feel normal. It's going to feel weird at first to do it a different way. But I think
yeah,
again, it's coming back to, you know, there's so many people that are, privileged to have this ability to move through this body that they have. And when they're taught, no, this is harming you, that's not great either. Like, we need to help you find a way to
yeah,
move safely that feels good and you can kind of find that joy. And again, um,
yeah, yeah. I agree, and I think it's every person is so different, but I think what can be challenging too is that when someone starts to discover that maybe they've got uh, really multifactorial hypermobile issue. They're dealing with POTS, maybe they're dealing with MCAS too. They've just got a lot of symptoms going on. I think that they can maybe get told, uh, not intentionally even, but like a fragility narrative where then they
yeah,
feel really scared to move again, but they're inherently want to,
right.
and helping them find the right path to be confident again and know
Hmm.
that um, and we have research that backs up that people with bendier joints still get strong at the same rate as people who aren't hypermobile.
Yeah.
They just sometimes have more interruptions. I think that's the thing. It's like, yeah, you
Mhm.
maybe don't progress quite as quickly sometimes because sometimes you're just going to have maybe a more painful day or a day where you're more symptomatic. And
Mhm.
so you have more blips in that
Right.
interruption, more interruptions, but that over time, or maybe you have to start with like a little bit lower dosage at first until you can really get that down, but you can still load your tissues and they need to load their tissues. That's actually what's
Yes.
good for them is moving and getting tissue loading because that rule doesn't just go out the window just because they're bendy.
Yeah.
Um, and a lot of times they're feeling terrible because they like it's sitting in one position. That's
Right. That's
often
the
the worst
problem,
part.
right? It's like, no, no,
Yeah.
no. I need
And
you to move.
a lot of times for me, a lot of my pain issues were so much more prevalent when I was in PT school and I was sitting so
Mm.
much more. And I had
Mhm.
gone from I was dancing hours a day and working at a really high level to sitting a ton. And that's when my body really told me a lot about
Right?
how much it liked to move and needed to move. And I think
Yeah.
that is for a lot of people, just as
Yeah.
life is busy.
Yep.
Um, or dancers that maybe aren't able to dance all the time anymore.
Yeah.
They're actually maybe having a harder time when they're sitting at their desk at work
Mhm.
and and their body needs to move and change positions a lot and it
Yeah.
needs
Are you seeing I'm seeing in other sports, but I'm curious in your world, we're seeing a lot more women staying active in pregnancy and
loading.
postpartum in a lot of other sports. Are you guys kind of seeing that too and kind of starting to get some guidance through that?
Yeah. It seems to be a thing where I know a lot of dancers who danced, up until baby was born.
Hmm.
Um, I think that has been pretty common, but what has lacked probably similar is just like good guidance postpartum on returning to
Hmm.
sport.
Hmm.
There are some research groups that are really advocating a lot now in the dance world, doing a lot of work in Australia and Europe and other countries, along with working with people in the US, that are really trying to find good guidelines for
Hmm.
return to sport. Um, and there's a lot that we're trying to do, maybe even taking from the more recent kind of return to sport running guidelines and just thinking,
Hmm.
what's that parallel
Right.
for dancers in terms of getting them back? I
Yeah.
think the real big challenge in the dance world is we're not highly paid athletes. The arts don't get a lot of funding. And so a lot of artists are also like gig worker, they're working one job to another. So they might not always have consistent coverage for
Hmm.
healthcare and they
Yeah.
still, um, experience difficulty finding providers who understand their
Yep.
demands. So that's something we're still working on. And so that can really be a piece where already we have a really hard time providing good care
Hmm.
for new parents and people who have just
Right.
had a baby. And they don't always get that information and support or have
Hmm.
access to care. Um, so people are working on getting better guidelines. But
Hmm.
I think dancers are also a lot of them are like, I can figure this out. Um, I'll get back to it. And right, everybody's so different. There's some dancers are like, yeah, I started dancing again so early after I had my
Hmm.
kiddo. I've been fine, not having any problems. And then the person next to them had a really difficult time
Right.
returning from
Right.
birth.
Yeah.
Um, but yeah, I think like other sports, we're starting to kind of have lots
Hmm.
more conversation. There's a lot more
Yep.
people out there who are really advocating for better care and
Yeah.
return to sport that really makes sense with guidelines.
Yeah.
So it's getting there. I think
Yeah.
I think we're on our way, but
I
it's kind of the overall access to healthcare for artists that's really challenging.
Right. Well, and I think, that that would almost be a parallel to a lot of our pro athletes that maybe don't have contracts or things like that. And they're,
Yeah,
they get a couple thousand here from a race or a couple thousand there or something like that, versus like pro sports teams. I mean, even, pro soccer teams and things like that, just trying to get clear guidance on, can you participate? Are we going to allow you to play? Like
yeah,
that kind of stuff. But I feel like
yeah.
there's there's some generalities that I think all sports can have these conversations, and then I think there's nuances. So for example, with like soccer and rugby, we have like the question of impact.
Yeah.
I'm sure with an aerialist, is it a good idea to throw a pregnant woman down a silk? Like, I don't know. Like, I'm guessing not, but I mean,
Yeah. And it's
or
hard. And yeah, trying to figure those things out with impact.
right, but then also like access to, again, it's a bigger picture of, do moms who perform have lactation support? Do they have menstrual
Hmm.
support? Like, I mean, there's all these bigger questions that I do appreciate. There's a lot of organizations kind of rallying around and collaborating and then dealing with their own specific nuances. But the fact that we're having these conversations, but yeah, specifically speaking to performers, having kind of done that a long time ago, that was always a concern. If you were with a company, you had this care, but if you stepped out and you were just kind of doing things on your own, like it made it much harder. Most of them didn't have insurance. But
Yeah.
yeah,
Yeah.
it's a challenging question to access and privilege and all that other stuff. That's a
Yeah.
whole separate podcast. All right, before we finish up
Exactly.
here, real quick, I want to ask you, you did a study in 2023 looking at prevalence of urinary incontinence and pelvic floor symptoms in female professional dancers. Tell us quickly about that.
Yeah, so this was a survey study that we distributed online. So it was an open survey, and we ended up analyzing a little over 200 dancers that responded. So this was all professionals, fairly young in age, and most of the people who responded actually had never been pregnant, had never had a baby. We had some who had, but the majority had not. And we looked mainly at rates of incontinence, whether they're experiencing incontinence. So we had about a little over 34% said that they experienced leakage. And that was, I mean, there's lots of different values that we see reported for other sports, but it kind of puts them right in there with a lot of other sort of average numbers for other female athlete studies that we've
Hmm.
seen. Um, that we know that these high level dancers, there's a pretty good portion that are experiencing leakage. Mostly seems to be stress incontinence,
Hmm.
though some are experiencing urge, but stress incontinence was more common, and that this is an issue that's happening even sort of regardless of pregnancy
Hmm.
and delivery. It's happening kind of early into the age 20.
Hmm.
Um, and we also asked other questions. So around, I think it was around 8% were having symptoms that we might associate with pelvic organ prolapse. But again, this was self-report. They're looking at
Right.
symptoms. And then we had asked if any of the dancers had experienced pain with sex. And I think it was about 44% said that
Oh,
they had. It was a huge number. That wasn't our main outcome, but that's something I'm very interested in
yeah.
exploring in the future is what is that
Hmm.
looking like? It's a really big number. We also got a huge number who reported having, um, you know, over 50% had back pain, hip
Hmm.
pain histories where they had sought
Yeah.
help from a healthcare provider. So there weren't any associations between that, but we know that there seems to be this big link between leakage and things like back pain.
Hmm.
Um, yeah, and then reports of menstrual irregularities too.
Hmm.
We didn't look at anything specific to reds or
Hmm.
specific to that, but it was interesting to kind of look at.
Yep.
And then also high rates of experiences of heavy bleeding.
Hmm.
So a lot more that we would love to explore.
Yeah.
It seems like the leakage was kind of rated like mild to moderate, wasn't a huge amount.
Hmm.
That they were able to move on and be functional, but still definitely a significant issue.
Yeah. No, I have so many studies I'd want to do from that. Again, I think that, you know, having some sort of baseline data, and it's interesting to note that it's pretty comparable to other women in sport around the same
Hmm.
age. We need to be having conversations with our females in sporting before they even are considering getting pregnant, because if there are issues, then there's likely going to be issues, pregnancy
Hmm.
postpartum. And the more we can have these conversations now, especially in those contexts where it's normalized, like gymnastics,
Yeah.
normalized, dance, things like that. Like, let's talk about it now. And maybe is it possible that we can impact our pregnancy and postpartum pelvic health outcomes by addressing it sooner? I don't
Yes.
know. Like, call me crazy, but I love that. But that's where I think that data like that, even just a survey study, is incredibly important. Is like, ooh, pelvic pain, pain with penetration, 40%. And you and I are both like high tone, high tone, high tone. And I mean
Yep.
the stress urinary incontinence, we're already thinking that anyway. So
Hmm.
total, bias confirmation here. But if this is what's going on and we're setting up our moms, potential future moms, entering pregnancy with a high tone pelvic floor, and they don't know they need to relax that pelvic floor for vaginal delivery. Oh God. Like,
Yep.
again, I'm thinking
Hmm.
prevention as much as possible. And that's where I'm like, oh my
Yeah.
gosh, the more people that work with this population, or somebody who danced when they were younger, or if you're listening to this and this is you and you haven't been pregnant yet, or you did and you're wondering what the heck is wrong with you, like, these are patterns of movement strategies and muscle behaviors that are really like very familiar to us, and I
Yeah.
think much more to pelvic floor PTs more often, or more than there ever was before. We can have conversations to see how we can address this stuff. So it's
Yeah.
exciting to see, yay, we're talking about women in sport. Yay, dance is a sport.
Yeah.
Now
Yeah.
let's help everybody.
Exactly. And it has been really exciting to see at least in the dance medicine world, more and
Hmm.
more people are talking about pelvic floor issues. More and more people are talking about
Yeah.
supporting dancers postpartum.
Yep.
So it's exciting to see. It's the need to kind of get that information though out to the
Right.
general public, so we're not all just talking to
Right.
each other.
Yep. Yep.
Yeah, trying to get that there. And I'm diving in. Another thing we're kind of interested in is also down the road looking at kind of adolescent dancers, younger
Yeah.
dancers. Like, is this issue of leakage starting early?
Hmm.
So starting to kind of put some things together with a researcher in the UK to look at some
Mm.
adolescent dancers and kind of figure out what the prevalence of these issues are, like how, because we're curious kind of how early is this all starting for
Right.
our athletes. So it'll be kind of interesting to see,
Yeah.
how early could we come in and help educate or help mitigate
Right.
symptoms to help later in life and help,
Yeah.
then as they navigate pregnancy and
Well,
postpartum.
I'm just thinking of our local area here. We have probably 3 dance studios within a mile of my office, and friends, everybody, we've got friends of friends that, dance and whatnot, and just the type of dance. I feel like everybody's doing everything.
Yes.
Um, but I do feel like it's a bit different from when I used to work at this one practice probably 15, 20 years ago now. We used to go to a boarding school in DC that was very much the Russian. um, they, they
Hmm.
they kick you into the position, they force you into that. I
Yep.
think we're not doing that anymore.
Yeah,
I don't know, you
I would
tell
say
me,
less
but
often. I still I still get some dancers who've
oh,
maybe been at a studio. It's less, I think it's less common. I think we're getting
okay,
there. But
okay.
still have students that had teachers kind of not use the best strategies to teach them techniques.
Mm-hmm.
But it's definitely less common. It's definitely not
Yes,
as much of the thing. I think
but
still have a long way to go, but
you know where we need to
it
talk
always
about it
amazes
though?
me when I see it.
Where it comes back is our perimenopause moms that,
Mhm.
like, they want to dance, but that is like traumatic, and that's how they hold things. I was like, we need to talk about
Yeah.
that. And that's not
Yeah,
great. And we need to move your body more freely instead of worrying about if somebody's going to whack you into a position.
exactly. Yep, yep. I have heard some stories about how people were trained when they were younger. And yeah,
Hmm.
helping them find that joy again and just knowing that they can,
Hmm.
helping them hop into a class where they can really get some time for
Yes.
themselves and have fun and
I
yeah,
was
that's what
not
it should be.
I was not built to be a dance mom. My daughter went to a studio across the street. I think like she'd just turned 3, and they're like a little leery about her being that age and going, I forget what it was. And the first class, they had a sub and it was wonderful. And she came out and that first age where they're just barely away from you and super excited. Second
Yeah.
class she goes in, it's the regular teacher. We're sitting out in the hallway, which is hard enough. And then my daughter, because it's a new person, like she's like kind of not completely participating, but she's also 3. And then at the
Yes.
end, you only got to dance with the tutu if you participated. So my
Oh no.
daughter at 3 doesn't get the tutu. So she's, of course, that's not going to make her want to participate. She's freaking
No.
devastated. I immediately walked to the front and I'm like, I'm like, I'm done. I need my money back. And they're like, well, you
Yeah.
can take it with another teacher. I'm like, no, I am done. I cannot know.
I understand. Oh no.
So,
No.
but my daughter still remembers that. She's like, I danced. I was like, for a day. I'm like, I can't handle this. Oh my gosh. All right. At the end of every episode, we ask a couple of questions. What's a book you're reading or podcast that you're listening to right now?
Um, I am reading, I love to read fiction. So I'm reading All the Colors of the Dark, and it's
Ooh,
quite dark. So we'll see how it goes. But it's really good.
okay. I can't deal with anything dark right now. So I'm
I understand.
I'm in DC. We can't
I
do
have to
that.
follow up with a light reading after
I
this.
think that's smart. All right. How old are your kids, by the way? I forgot to ask you in the beginning.
I have a son who's 9.
Oh, 9
Yeah,
is so fun. It's right before the 2, the double digits. Oh,
I
then they
know.
just
It's a
get
really
old
fun
really
age.
fast. Oh my gosh. What's your favorite
Totally do.
activity since becoming a mom?
Um, I actually, so my son's really into baseball right now, so
Oh yeah.
I like to try to play with him, and I don't have a lot of talent for it. But
Hmm.
he's pretty patient with me,
Oh,
and
good.
will try to teach me, to a certain end. But yeah, getting outside, and then I would say also just hiking. I love to be
Yeah.
outdoors.
Yeah. In
Yeah,
California, you guys got a sweet spot for that. I love it.
yeah,
All
we're
right.
we're pretty lucky.
What is one piece of advice for moms?
Hmm. Um, I would say there's no way to be perfect. There's no way to do it all. Just hang in
Yes.
there and support each other.
Love it. Love it. All right. And then who's somebody in your space who's really got your attention right now? Who are you fangirling over?
Oh, ooh. Um, I'm just pausing because there's too many people.
I know.
Um, I am fangirling right now over a lot of the people that are actually in, like, several people in the UK that are doing the work with athletes, like rugby players and soccer
Yes.
players, and kind of pushing for all of that care.
Hmm.
So all of those teams have been really exciting to me because I would like the same thing to be
Yep.
implemented in dance.
Yep.
So
I
yeah,
think Grania Donnelly's been one of those in
yeah,
Ireland.
yeah,
She's been in the pod, I think 3 times now. We're a big fan of
hmm,
Grania.
yes,
Yeah,
yes,
and then Michelle Lyons with FIFA, Emma
yeah,
Brockwell. Again, this is what I love about pelvic floor stuff is that it's just something that brings everybody and everything together. And the fact that like we can pull something from all of these sports and bring it forward to kind of help everybody else. And I feel like women, this is just kind of what we do naturally is like we're making that big,
yeah,
huge village. So yeah,
yeah.
that's awesome. Yay. All right. And then last one, what does it mean to you to be an active mom?
I would say kind of two things. One, I feel like I need to be trying to move and trying to stay strong because it feels good and it's my stress relief. So that's really huge. And then um, I want to be active to just keep up with my kid and be able to try more and do more and be silly and have fun. So when I strength train and when I move, I feel like I can see the difference it makes in
Hmm.
helping me be able to play, which I think we don't do enough of as adults.
Yeah. No, that's awesome. And you're headed in a teenage boy life. Don't be scared. It's okay.
Thank you.
My son is 14 now. We have learned that we talk when he sits next to me in the car or we're going for we just can't have eye contact. Then we can talk a lot.
Okay, I was just hearing this advice
Yes.
actually recently because I'm
Yes.
starting to notice if I asked a direct question with
No,
too much eye
it
contact
doesn't work.
already,
Mm-mm.
yeah, it's
I don't
going
know
nowhere.
why.
So this is good advice.
I'm still learning that. The other thing I have also learned too is I can't, and my husband's wonderful. He also like poor thing, he's still learning how to have a daughter too. He didn't grow. It was just him and his brother. I am learning that I can't always assume that he's told my son how and when to apply deodorant. And his first
Oh,
response when
okay.
we found the big whisker, because it was like an inch long, and I was like, "What is
Oh my gosh.
this?" One day I'm like, "What is?" And he's got like fur. Is that my
Oh,
husband's like, "Oh, let me get him an electric razor." I'm like, "No, no, no." And I did the quick mom check with my other boy mom friends, and they're like, okay, this is what you do. And we micro take care of it. We don't need to go all in yet. I think dads want to go
okay.
all in. And I'm like, no, no, no.
Got it.
Is this embarrassing you? Are you interested in doing something about it? If you are, please don't pull it. Let me help you use sharp things. And I will help you. So don't assume dad has it.
Okay.
Ask and be like, do you know how to use this? Would you like me to show you how to use this? Would you like me to get you 3 different options of deodorant and decide which one you would like? Because you're probably
Okay.
not going to pick the one that I would pick. But if you have it early and often, you're good to go and no eye contact. So that's my
Yes.
teen.
Okay.
That's my advice to this point. I'm allowed to change it as we go further, but that's my advice.
Oh, I
You'll be
appreciate it.
okay. But it's cute when they get
Thank
bigger
you.
than you. My son is now taller than me,
Oh my gosh.
but such
Yeah.
good
I'm,
hugs. The best
oh,
hugs. Yeah. So you have that coming. So,
it's
all right,
wonderful.
there's my tips. All right.
Awesome.
If you'd like to know more about Brooke and the work that she does, you can find her over on Instagram, Dr. Brooke Winder PT. Thank you, Brooke, for joining me, and good
Thank you
luck
so much.
with teenage boy life.
Thank you. I appreciate it.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.